Hi, my name is Chris March, and I have a proposal on how to spend our capital to improve Dutch Flat Hospital. Dutch Flat Hospital sees 1.5 million patients, and we expect that volume to go up 5 to 10%, this next year. And we have a $2.25 billion total operating expense. Our community served is 1.5 million people, and we charge $400 per 24-hour stay in a hospital bed. Our fiscal payers break down to 33% Medicare, 33% private insurance, 33% self-pay or international patients, and 1% indigent care. I'd like to propose that we do a clinical integration of electronic health records at Dutch Flat Hospital. Prior to the passage of the ACA, the American Recovery and Investment Act of 2009 laid a foundation with high tech, and high tech creates standards for meaningful use and introduction of the electronic medical records. Through meaningful use, hospitals can receive payment incentives from the government for integrating these systems. The integration through meaningful use will help address any of the patient complaints that I'm about to tell you about. And meaningful use has been shown to improve the quality and patient outcomes through the integration of these EHRs in the hospitals and providers. Well, the patient complaints we've had at Dutch Flat Hospital, the patients are extremely frustrated that they have to bring their paper records everywhere they go, to the hospital, to the office. They complain about the hospital they often run duplicate tests because the records are not available from the physician's office lab, from the medical office to the hospital. And they complain that the physicians and nurses are always in a hurry and don't follow up because they're always trying to find the information they need. Departments from the hospital, they don't communicate. The information isn't readily available to them because records aren't shared or passed and handed off. Patients want updates in real time. Whenever possible, it's important that they can see their labs or information from their physician. They don't want to sit and worry about something. If they can get the information right away, they want to do that. However, the doctors and nurses don't have that information to provide to the patient. Results of tests and other care related is not readily available to the patients, like I just mentioned. If they had a patient portal, they can go in and they could see this information. And there's just no follow-up with patients after their care. It just causes more readmissions, confusion, and it costs the hospital and the providers a lot of money and the patients a lot of money. Some incentives to adopting the EHR. Well, we want an improved quality and access to healthcare for everybody. So we definitely going to have an improved quality, and the access is going to be much easier for the patient and for the providers. A better method of storing, analyzing, sharing this information, because it's going to be one central location, either at the provider or at the organization, the hospital, and available to the workers and through a portal for the patient. There'll be a reduction in the lack of information or this misinformation because it will be located in a central location. Through this, you'll have improved patient safety, productivity savings, because there won't be someone running around trying to maintain the records or trying to find this record or this answer because they'll have it right in front of them. Medication errors will be reduced because you won't be giving a patient a medication that is wrong, because you'll be verifying that by scanning the medication. You'll also be able to see if you're going to have a reaction from a medication because it doesn't work well with a medication the patient is currently taking, because that'll be in the record. You'll be able to manage the patient's chronic diseases, COPD or CHF or any of these diabetes through preventive medicine and links that you can provide through a patient portal to these patients. You can assign them education and schedule them for classes. And through this whole thing, you'll have organizational cost savings through reduced readmissions. Patients are taking care of themselves and educating themselves and learning what the warning signs are and how to reduce or change their chronic diseases by improving their health. Meaningful use through national health reform. Well, the healthcare center network, which we qualify for, offers a meaningful use grants, and we want to take advantage of that. That'll also offset the cost of putting this in the hospital. Medicare and Medicaid have an incentive program. They provide incentives up to $2 million for hospitals and $63,000 for physicians that do it in their office or implement it in their office. Access to data through the National Health Information Network. That's the big thing here. All this information is being shared. It'll be secure, but it'll be shared, and that way patients have access to information, and healthcare providers, you're on vacation, they'll have access to your chart. They can gain access, and they can share information through these portals or secure networks. And there'll be improved quality and measurement of information being provided. There's big data there you can pull, and you can learn what is going on, what types of patients you have, how you're going to have to adjust your services. There's a lot of different things you can get to improve the quality of care you're providing at your organization. Economic and other considerations with implementing this. Well, the cost of updating the network infrastructure to support a hospital-wide EHR can be quite expensive. We have $1.5 million to offset that. And I think with the grants and these future incentives, I think we should reinvest in the future here, and knowing that we're going to get a lot of money back from the cost savings through implementing this. The cost of the EHR program itself with the chosen vendor. We would have to pay for that, whichever we decide, Cerner or Epic. We have to train our staff to use this. And more importantly, we have to get them to buy in on this. We're going to be changing the workflow, and we want to gain some leadership or frontline staff, super users, and train the other staff and tell them why this is a good thing, and this is going to improve how they work in the hospital. It's going to change, make their work better. We're going to need leadership support throughout this process. The administrative leadership needs to be right there and checking in on staff and telling them and supporting them, telling them why this is a good thing and supporting them and their adoption of this. Again, improved quality, better method of storing and analyzing, or reduction in information or misinformation. We're going to have improved safety, productivity savings, a reduction in errors, and that's always good. And we're going to be able to help these patients with preventive medicine to manage their disease processes. And overall, we're going to get an organizational cost savings in the future with better outcomes for our patients. Are there any questions or comments? Thank you so much for watching my presentation.